My name is Leslie Barshop. I'm 67 years old, and I'm here because of the Phoebe Lynn Lewis Foundation, which advocates early screening for lung cancer. And I'm one of those people who was accidentally screened and am responding very well to treatment.
Dr. Schneider, thank you so much for being with us to discuss your groundbreaking work in lung cancer research. How did you become interested in lung cancer screening?
So first of all, thank you so much for having me. I think that the opportunity to talk to such an enthusiastic audience is exciting for me, and a great opportunity to get the word out about lung cancer screening, which is sort of under-recognized even in the medical community. I am a medical oncologist, which means I'm a doctor that takes care of patients with cancer, and in many respects, I take care of patients with cancer that can no longer be cured surgically. It turns out that my focus of interest is in lung cancer, where very few of the patients actually ever get a chance at a surgical cure.
I was diagnosed 3 years ago at 65. I had had massive spine surgery, and the day after surgery, my oxygen levels weren't normal. They were worried that I had a collapsed lung, so they did an emergency CAT scan at 2 o'clock in the morning, and lo and behold, my lung was not collapsed, but I had a tumor on one of the lobes. I had no symptoms, no idea whatsoever that I would have lung cancer. I was crazed. Like, I remember I was in the hospital and they brought the tray. When the doctor told me it was a tumor, I took my hand on the tray and I threw it across the room. That was my initial response. Like, how could I have to go through this?
Lucky is actually the number one way in which we find early lung cancer, because not enough patients are being screened. And what do you think lucky might mean? What do you think it might mean to be lucky to find a lung cancer?
You're not expecting it.
Sure, that's exactly right. So if see this all the time, somebody has to have an operation for their knee, and they get a preoperative chest X-ray. And the chest X-ray shows a nodule. That might be an early case of lung cancer. And that would be what I would call lucky. It's not smart, you didn't do it on purpose, but it's quite lucky for that individual. So when you look at the minority of cases of lung cancer that are found early, even in the era where we know that screening can be useful, most of the early stage lung cancer that we do find, which is a small fraction of all the lung cancer, is because we got lucky. Somebody had some other reason for going for an imaging of their chest, and they happened to find a cancer that was then in the early stages.
Well, it was detected by the CAT scan, and it was solved. I had had surgery in May, and they did some kind of robotic surgery where they just took out the lobe. I just had 3 little cuts, and they took out the lobe, and the doctor said that I would have routine CAT scans, but not to ever be afraid of these routine CAT scans, because I was fine.
If we recognize that the reason for that disparity, that there's so many deaths attributable to lung cancer, it's because we do much better if we find cancers earlier on. The reason for that is when a cancer is found early, it can often be taken out surgically, and it's sort of a one and done kind of deal. where the cancer comes out and patients can be free of the disease.
When you tell people you have lung cancer, the first question is, oh, you smoke? And I stopped smoking 30 years ago. So, not to say I didn't smoke. I smoked in college. I continued somewhat after that, but when I stopped, it was 30 years, never had a cigarette. I had terrible nicotine withdrawal. I would never even think of putting a cigarette in my mouth. So and I know several people the same thing who had cancer and had stopped about 30 years before.
Again, it comes back to the fact that if you don't have a screening, so if you don't have a screen, you can be smart about something, or you can be lucky, or you can be not so smart. So screening is the smart way. You know people that are at risk, you have a test that helps you to find cancer early, and you're intelligent about applying that test.
So thank you everyone that's here out today, especially the Phoebe Lynn Lewis Foundation for your support of the Lung Force Walk New York City. And through Lung Force, we're raising funds for lung cancer research, education, and advocacy efforts, and specifically to educate people on the importance of early detection of lung cancer through low-dose CT screening for lung cancer. The high-risk population right now in the U.S. needs to know that this life-saving screening exists. Treatment options caught in the early stages of lung cancer are so much more available than later stages, and the survival rate is much higher. So we're working together to educate people and celebrate the ability of our breath to breathe and be here at the Lung Force Walk New York City.
So really what we notice about vaping is there's a whole lot of different devices out there. Why were e-cigarettes created in the first place? Okay, and to wean people off smoking, right? So smoking cessation, it was a tool for that. People who were nicotine dependent, they could use this device and safely taper down their nicotine level, and that's what the e-cigarette was created for. Definitely not here to debate whether that's beneficial or harmful, right? For a grown adult, I'm sure that there's a lot of benefits to that. Ones over here you might notice, like those were the most common ones when they came out. They had a big battery cartridge, and that was used for the tapering down of the nicotine. Now you'll notice these little skinny ones that look like disposable cigarettes. You'll notice the pen or this sort of like marker one over there that kind of has a cartridge in it, and that's really common for THC oil or marijuana oil. And then you have the Juul, which is everyone's favorite, right? Most of us have heard of this by now. The Juul product is by far the most commonly used among young people. In every school district I've been to in the past year and a half, I've done some sort of presentation on vaping, and this is the most common one in every single district on Long Island that I've gone to. So this is typically the most widely used vape product. It looks like a flash drive. If anyone has seen a Juul, it looks like a flash drive. To make matters worse, it plugs right into your computer to charge. So it plugs right into that USB port. If you're noticing maybe that your kid has the abnormally long flash drive in their USB port, maybe now you know why. So this is definitely something to consider. Anyone know the nicotine quantity in a Juul pod? This little pod, right? So it's about 200 puffs if we're kind of breaking it down. And that has the nicotine and the flavor in it. How many cigarettes do you think it would equate to if we're talking about nicotine? Full pack of cigarettes, yeah. It's a lot. 20 cigarettes, right? It could be lasting them a day, it could last them a week, it could last them a month, but they're gonna have to replenish it every time it's out, and it has a high quantity of that nicotine. The FDA is very slow to catch up on the regulation of this product, which is another big concern. So right now, you'll hear kids say it's way more healthy than cigarettes, there's no harm to it at all, right? But now we're showing that short-term research that's coming out to say maybe not so much, right? Maybe we do have to look at some of these health consequences. The problem with this is we don't have enough long-term research. We don't have that longitudinal 10 to 20 year study to tell us what's going on. This product is within 5 years of its birth, right? So it's really gonna slowly catch up to us. In terms of the health effects, we're noticing again, some of that short-term research is coming out telling us that the copper and the metal inside the product is what we really have to be aware of in terms of the consequences, because what you're doing is essentially heating up that metal to 100-something degrees and then inhaling it. So you're lighting a battery on fire and inhaling it. And when I talk to kids, I literally say that. So copper, arsenic found in bug spray, right? Found in wall paint, things like that. And then of course other chemicals that we don't really know yet. What are going to be those long-term effects? We have respiratory consequences. There's been links to popcorn lung, so you do see that correlation. Again, early research. It's not even something that's 100% proven yet. And you can all remember whenever we were younger, cigarettes, we did such a good job with the cigarette campaign, right? We know the harmful effects of cigarette smoking, but years ago, women would smoke while they were pregnant, and we didn't even know that it was harmful, right? And now here we are with all this research, so we're really worried it's gonna be very similar.